My name is Dr. Rosanne Jepson. I'm a senior lecturer at the Royal Veterinary College. I work within the internal medicine service. I spend some of my time working in the referral hospital, but I actually spend quite a large amount of time working specifically with cats as they get older. And one of the problems that we see very commonly in that population of cats is high blood pressure or feline hypertension. Feline hypertension, or having high blood pressure, is really important. It's a problem that we've realised affects cats as they get older. So typically cats over the age of between 7 and 9 years of age. It's a problem to us because actually externally it can be very difficult to tell that a cat has high blood pressure. And in fact, really the only way that we can often tell is by measuring blood pressure, perhaps as part of a health screen. Sadly, there are some cats where we do identify that they have high blood pressure, and one of the commonest reasons for owners to bring those cats to us is because they've gone blind. And so this is really what we're trying to prevent when we want to check a cat's blood pressure, because we want to try and make a diagnosis of a cat having high blood pressure before it actually develops those problems. Feline hypertension means that a cat has higher blood pressure than is normal. So we have some information available to us about what the blood pressure of a normal healthy cat should be. And actually it's not that different from us as humans. But what we do know is that cat blood pressure does increase with age. And we know that there are blood pressures at which other body organs become at risk of damage from that high blood pressure. And so we have guidelines which help us to make a diagnosis and tell us the point at which we should become worried about a cat having high blood pressure, and that's the point where we would want to actually start treating their high blood pressure with antihypertensive medication. I think unfortunately some of the saddest cases that we see of cats with hypertension are when they have gone blind, and that is the first sign that owners have seen. So perhaps owners will notice that their cats are not able to get around the house as well as they once did. They're perhaps bumping into items of furniture that they didn't before. Or some owners actually notice that the eyes have become very large, so the pupils have become very big. And so I have seen a number of cases that obviously present in that way, and sadly sometimes even though we can start treatment to try and prevent further damage, for example, to their eyes and the other body organs, the heart, the kidneys, sometimes they're not able to regain vision. In a small number of cats, however, we are able to treat them successfully, and we will be able to get some of those cats back to having vision. So there are certainly some similarities between hypertension in cats and in humans. One of the main similarities, I think, is that we see hypertension in cats as they get older, and the same situation certainly occurs in humans as well. And in human medicine, hypertension is sometimes referred to as the silent killer, because as an individual you may not be aware that you have high blood pressure unless you have your blood pressure measured. And this is certainly true in cats as well. The majority of the times that we make a diagnosis of hypertension, it's because we're actively trying to measure blood pressure. We also know that there are some similarities in terms of underlying diseases that can predispose or increase the chance that both cats and humans develop hypertension, and kidney disease would be a key example there. There are some advantages though to being a cat and having high blood pressure compared with being a person with high blood pressure, and the main advantage is that we have a very effective medication, and that the most cats can be treated with just one medication given just once a day. In contrast, many people who are diagnosed with hypertension will need to take at least 2, perhaps even 3 medications in order to bring their blood pressure back into a normal range. So the main difficulty that I face when we're seeing cats is really encouraging owners to want to measure blood pressure. I find that one of the best ways to do this is to incorporate actually measuring blood pressure being part of the routine health check that we do in older cats. But it's very important that just because we measure blood pressure once, that we don't stop at that point. And actually this is something which we would do on an annual basis or maybe a 6-monthly basis, depending on how often that cat is requiring follow-up examinations. And that really helps us not only to know what a baseline normal blood pressure is for an individual cat, but helps us to detect when that cat is at risk of high blood pressure and might be developing hypertension, and enabling us really to actually start treatment before they develop some of the problems that we can see with hypertension, such as damage to the eye, the heart, the kidneys and the nervous system. Diagnosing hypertension in cats, it obviously involves making a blood pressure measurement, and I think something that really worries a lot of owners is whether this is going to be a painful or a difficult procedure, something that their cat is not going to like. But the truth is that actually it's very quick. It normally takes less than 2 to 3 minutes to take a blood pressure reading. It doesn't hurt at all. It perhaps feels a little bit strange the first time we measure blood pressure in a cat, but most cats are incredibly tolerant and are very happy to allow us to measure their blood pressure. It's quick, it's easy, and cats really don't mind us doing it. We're going to measure Fleur's blood pressure. This is very similar to having your own blood pressure measurements done at the doctor's. So we put a little cuff on her leg here. And then just to get rid of the dirt on the back of her paws, we're going to use a little bit of a spirit swab down the back of her foot, which really just cleans it. And then we're going to use a probe. So instead of a stethoscope, which is what your doctor would use to listen on your arm, we're actually going to use a probe. So we're going to be able to hear the sound of the blood flowing down the back of her foot. So it just feels a little bit unusual, but it doesn't hurt at all. And so there we can hear the sound of the blood flowing down the back of her foot. And then we're just going to inflate the cuff until the sound disappears. And then gradually deflate the cuff. And when we hear the sound come back, that's the point at which we actually make the first reading. So her blood pressure is completely normal. We normally dispose of the first reading and then we take a series of 5 readings. When I'm talking to owners, I think the most important thing is to get them to relate to the fact that their cat may have high blood pressure. And I find that often the easiest way to do that is to try and help them think about it as perhaps some of their relatives that they may know who also have high blood pressure. And by doing that, we can make them or help them to understand that it's not necessarily a problem that they're going to be able to see on the outside of their cat, but that there can be problems that having high blood pressure creates inside the cat. And by helping them to understand this, we can help them to understand the importance that when we make a diagnosis of high blood pressure, that it's important that we treat that to try and prevent some of the secondary consequences of having hypertension. My message to cat owners would be that certainly as their cats get older, and by older I mean mature cats who are perhaps over the age of 7 to 9 years of age, that it's really important that as part of an annual health check we think about measuring blood pressure, because on the outside they may not realise that hypertension is a problem, but measuring blood pressure is such a simple, quick and effective way for us to do this check that it's something that I feel most cats should be having done.